Hi, I'm Chris, also known as AD Prop Push on another channel, but today we are going to be making our very first video on my new channel about medical stuff. I am seeking out to educate the general population about chronic conditions, diseases, and other medical things and how medical stuff works. I'm doing this so that you can better understand things and be able to talk with your primary care providers and medical team about treatment options and help you understand what is going on and why things are done the way they are done. This is not a channel made to help diagnose things or any of that nature. It's solely just to help educate and better to understand things. And with all of that being said, the very first topic I would like to cover in this video is actually blood pressure. Blood pressure is one of those things that it contributes to a lot of different illnesses and diseases and needs to be very well understood to push on to other things. It's also a good way for me to branch out to other processes and help build video to video. That way you can follow along a little easier. I'm going to try to stay out of some of the more technical terms and advanced parts of this and keep it nice and simple so that it's easy to understand. So what is blood pressure? Blood pressure is the force that is applied to the arterial walls during the heart contraction and release. You have two numbers, the systolic, which is the higher number or the higher blood pressure during the contraction of the heart. Then you have the diastolic, which is the bottom number or the lower number. And this is whenever the heart is in its resting phase, and it is the remaining blood pressure when the heart is no longer exerting extra force to the vessels. We measure this in millimeters of mercury with a cuff, and generally what you're going to do is squeeze. What the cuff is doing is squeezing down the blood vessel until it pinches off the blood supply. Whenever it starts releasing the air in the bladder of the cuff, it will eventually allow blood flow through the artery again, and that is the systolic pressure. It's whenever that first little squirt of blood is able to pass through again. Diastolic is whenever we have released enough pressure to where the maximum amount of flow with the pressure that is there is returned. That is the diastolic. So the numbers that we have determined as a good blood pressure is 90 over 120 on a systolic, or the top number, 60 over 80 for the bottom number, or the diastolic. We've determined that this is basically the best blood pressure because prolonged exposure to this blood pressure shouldn't cause any major damage or any damage and will adequately perfuse the body. Once you go over these numbers into high blood pressure or hypertension, prolonged or extended pressure up in this range can cause damage to the vessels. And then if you go below these numbers, hypotension or low blood pressure, we're not perfusing these organs enough. So think of it kind of like a hose. With a hose with a good pressure, it's going to push the fluid from one side to the other without any issues. However, kink it off, increase the blood pressure, any of that, it can damage the hose itself. Or if we lower the pressure and it's not enough pressure for the fluid to reach the other end of the hose, we're no longer perfusing the end. So that's kind of the best way to think about it, is a hose with fluid in between. So what are the things that affect blood pressure? I'm not going to get into the hemodynamics. I may do that in a separate video, but for this video, we're going to keep it simple. It's the same concepts that affect hemodynamics, which is the numbers that make up a blood pressure. And that's going to be heart rate, blood pressure, and restriction or resistance. So heart rate, the faster the heart beats, the more blood is being pushed with each beat. Or more beats equal more pumps, meaning more blood, increased pressure. More volume means more pressure pressing against the vessels, meaning more pressure. And then also your veins can actually dilate or open or constrict or close. Trying to push that many huge amount of fluids through a tiny hole is going to increase pressure. Trying to Push fluids through a big hole equals lower pressure. And there's a bunch of things that can contribute to these three big things. And a lot of these are actually related to lifestyle choices. So one of the first ones we're going to address is diet. Diet is something that can affect us in many ways. One thing it can do is an improper diet can actually add stress. And with stress, it can release hormones, which can affect blood pressure. I'm going to cover that a little bit more in a bit. Just know that stress, inflammation, things like that can cause your blood pressure to go up due to hormones. Then you also have fats. Increase some levels of fats, particularly the LDLs, something that you'll have to get your lab work checked out with the doctor to know what that is and know what range you're in. But if your LDLs are too high, it can cause scar tissue and narrowing of the vessels and restriction of blood flow, which will increase blood pressure. And then the other big one, the biggest one out of the diet, is going to be your sodium intake or salts. Now, with sodium intake, generally we recommend about 1.5 grams or 1,500 milligrams of salt for the average human male, human adult, not male, adult. And that's a blanket statement. That's not necessarily what everybody should be getting. That is just what we consider to be the average for the majority. Some people actually may require more salt. Some people may require even less. It depends on the person on a case-by-case basis. This is one of those things that you definitely need to work with a primary care provider that knows what your lab works and what your body is doing that can help arrange how much salt you should be intaking every day. Another thing that's going to affect your blood pressure is exercise or how much exercise you're getting every day. If you're not exercising, it's going to affect how strong your heart is. If your heart's not strong enough, it's not going to pump very efficiently. It's going to raise your heart rate, which is going to increase your blood pressure over time. In that sense, especially whenever you're needing to try and start moving and exerting yourself. Where a stronger heart will have less issues doing this. Another thing weight's going to help contribute in is weight loss. We're going to cover that very next, but before we do, the amount of exercise we should be getting every day, or at least 5 days a week, is about 30 minutes of moderate exercise, which would be walking, a light jog, cycling, swimming, and dancing, something around that range. You can overdo exercise. Some people can do more exercises than others. That's going to be a case-by-case thing as well. But generally, as long as we're staying active, it's going to help our heart stay strong and healthy. The people that are going to have the biggest issue with this is going to be somebody that sits like in an office job and does nothing but sits in a chair most of the day. The only exercise that they're getting is leaving and coming to the office. All right. So weight. Weight is a little bit more complicated whenever we're talking blood pressure. So what weight will actually do is it increases the amount of tissues that we're having to perfuse. Your heart has to work a little harder and sometimes increase pressure to supply blood to this extra tissue that it normally wouldn't have to. Another thing that this extra tissue does is it applies extra force and pressure against the blood vessels, which increases resistance. With that extra resistance, that in turn is going to turn around and increase the pressure that is required to perfuse these organs and other tissues. So dropping the weight, less tissue to perfuse, less resistance on the vessels, lower the blood pressure. Another thing that we have to be concerned about, now this is one of the biggest ones whenever we're talking blood pressure, is smoking. Smoking has nicotine in it. It has carbon monoxide in it. Any tobacco product really is going to have some degree of this. Smoking is one of the worst when it comes to this, but it stimulates adrenaline. It stimulates cortisol with stress. Carbon monoxide renders blood cells useless for at least the ones that attach to carbon monoxide. And all of these play a huge role in blood pressure. So whenever you stimulate cortisols and adrenaline, that is a hormone that will actually cause your blood vessel to shrink. It constricts. And whenever you constrict, you increase vascular resistance, vascular pressure, and in terms, increases your blood pressure. It also, with the carbon monoxide, you have less working blood, and you have to increase the amount of blood that's being pushed through the body so that the blood that does still work can pick up the areas that the affected blood is no longer able to carry nutrients to the tissues and take toxins away. And another thing is smoking does increase the chance of atherosclerosis, which is the basically scarring on the inside of the vessels. And that's permanent. Once it's there, you can't get rid of it. It is a permanent thing that's going to cause your blood pressure to go up. It's going to restrict blood flow to certain areas, depending on where the atherosclerosis is taking place, and increase your chance of having other huge complications later in life. And also increase your chance of peripheral artery disease. Alcohol use is another one of those that we sometimes do. Generally, one drink every once in a while is not going to hurt you. But if you are drinking frequently every day, it's going to weaken the heart, which means the heart's going to have to work harder to pump, and it's going to increase blood pressure over time. It can also cause irregular rhythms, which makes the heart not as effective with pumping with each pump. And it can increase weight, which we've already discussed on how weight can affect blood pressure. Another thing that alcohol can do, and also smoking, but mostly alcohol is the one that we're talking about right now, is it can affect the way medications work. If you're already taking medications, whether it's for blood pressure or not, especially if it's for blood pressure, it can affect the effectiveness of the medications. It can sometimes make the medications work even more, lowering your blood pressure more than what you would like to. Sometimes it can cause it to where it's not lowering it enough. So that's one of those things that you have to watch out for with drinking while having being on medications. And that goes into another point where you need to be checking your blood pressure regularly. If you're not checking your blood pressure, we don't know if treatments are working, whether it be changes in lifestyle, medication we've added. They may not be doing what we need them to, and we may need to change something. Another thing is we don't always like to give out medications. We love for people to be able to fix things without the assistance of medications because there are complications with medications. There's risk. We give out medications when we've determined that the benefits outweigh the risk. So if we can prevent giving out these medications prior to, fixing it another way, we don't. But whenever we do, sometimes we overshoot as well. And sometimes we can make you go a little on the soft side or low blood pressure, which can be even worse. So that's one of the big things about making sure that you're managing your blood pressure and monitoring your blood pressure. So another one of the things that's going to increase blood pressure, and this is another really big one, is stress. Stress releases cortisols, which is a hormone that will increase the heart rate and restrict the blood flow, just like the adrenaline. Sleep is one of the ones that will increase your stress. Emotional stress is another thing that can do this. Sleep apnea. Sleep apnea adds stress to the body, and it sends a whole cascade that can increase the cortisol levels in your body, which will increase your blood pressure. It also has a buildup of carbon dioxide, not monoxide, dioxide, which causes your heart to go up fast and increases the amount of oxygen that you're needing and stress. There's a whole video that I can do on this later. So managing sleep apnea is another big one as well. And then also maintaining your stress and trying to figure out what's causing these stresses and how to deal with them, whether it be emotional, physical, caused by illness or sleep apnea or toxins that we're putting into our body. These are all things that can affect stress and cortisol levels. All right. So now let's look more, I guess, into what stages of hypertension there are, right? So we talked about with the normal blood pressure. We talked about it being over that, it being hypertension or high blood pressure. So you actually have pre-hypertension, which is going to be like a systolic blood pressure of 120 to 139, with a diastolic blood pressure sitting below 80. That's usually still a very sweet range that we can rely on traditional, like just changing your lifestyle choices and things like that to try to manage blood pressure before we introduce medications. Then we have stage 1 hypertension, which is going to be a systolic of 130 to 139, but a diastolic that is up to 80 to 89. Still very manageable, usually with lifestyle changes. If it fails at this point, generally you'll see medications get started on to help if we can't manage it with other things. Then we get to stage 2 hypertension, 140 over 180 on the top number, systolic, or above 90 on the diastolic or the bottom number. This is when a lot of times that you'll start seeing medications get added, unless there's still a really good opportunity that they believe that lifestyle choices can really fix this. But a lot of the times you're going to have a blood pressure medication at least added at this point in time, and to try to bring down this number, because we're at a point where a sustained blood pressure over prolonged periods of time can cause damage, like lots of damage, which will lead to other chronic illnesses. And we try to catch that early before any of that other stuff happens. Now, just because you get started on medications at this point, if we make those lifestyle changes and we are able to wean off of medications later, as something that you can discuss with your primary care provider. But this is getting on the high end of blood pressure, but there is one more that's a little higher, and that is hypertensive crisis. That is whenever you get a systolic blood pressure of over 180 or a diastolic over 120. This is like your range right here that puts you extremely high risk for like heart attacks and strokes. And if it gets high enough, it can make you symptomatic, and that can land you into the ER. And we're going to talk about some of those symptoms here in just a little bit. But this is a dangerously high blood pressure. Some people do normally live up in the 170s and 180s. It's not good. It needs to be managed. But depending on how fast you get there, sometimes the symptoms don't happen until later. Once you get up into like the 200s over the 100, like a 120s, that's where it's just like, yeah, you need to get to the ER, because something bad can happen any moment. So treatments, it's going to be addressing whatever's causing the blood pressure to be high, whether it be stress, alcohol, nicotine or tobacco use, diet, salt levels. These are all things that you can change and very relatively quickly see results in. And a lot of times they can work, and you can avoid medications. Like I said earlier, medications we do give out, we try to resort on other things prior to medications. And that's because with every medication, there's an increased risk of something else. Well, not increased risk. There is a risk of something else, but at this point that we're prescribing or doctors are prescribing these medications, the benefits of the medication outweigh the risk of the medications. So that's the other thing with treatments, going to be medications. So some of the symptoms we might see. This is generally going to be the really high blood pressures, headache, dizziness, blurred vision, nosebleeds or epistaxis, depending on that's the fancy way of saying nosebleed, shortness of breath, chest pain or chest palpitations, and fatigue. And then if it gets really, really high, you could actually even see some confusion and numbness and weakness into some of those extremities. And once you get that confusion and numbness and weakness, generally you're at a hypertensive crisis and you're symptomatic of it. You need to probably be going to the ER or at very least talking with a doctor. So having high blood pressure that is unmanaged will increase your risk. Doesn't mean it's going to happen. It increases the risk of heart attacks or myocardial infarctions, stroke or cerebral infarctions, kidney disease, heart failure, aneurysms, peripheral arterial disease, retinopathy or troubles with the eyes, vascular dementia, and sometimes some cognitive decline. So we talked about hypertension, treatments, what causes it. Now there's the other side of the spectrum, and that is hypotension or low blood pressure. This is generally going to be a blood pressure below 90 over below 60, 90 systolic, 60 diastolic. So this one's usually more short-lived, not with everybody. There is some people that chronically sit low, but generally whenever most people see, especially middle-aged adults, see hypotension, it's usually can be fixed relatively quickly, but should not be ignored. especially if you become symptomatic. And what I mean by symptomatic is if your blood pressure is low and you have dizziness, lightheadedness, fatigue, and blurred vision, you've had syncopal episodes or you've passed out. Fancy way of saying passed out, syncope. That means that your blood pressure's gotten so low that your organs are being affected from a lack of perfusion. And if you don't return a adequate amount of perfusion to these organs, they can fail, they can die. And that's usually, that's going to be irreversible damage. Usually it doesn't happen super quickly, depending on how low the pressure is, but it does need to be addressed immediately. So the top causes of hypotension is going to be dehydration, blood loss, medications, heart problems, and orthostatic hypotension. So dehydration, that obviously is going to mean that you probably should drink more. Blood loss, you probably need to go to the doctor. Usually this isn't going to be your top one unless you're on like blood thinners and you've made changes to the medications, or you've been hit while on blood thinners, or, some type of trauma has happened. There is some hemolytic diseases where blood just kind of destroys itself. Like there is other things out there, but this is not going to usually be your top one unless it's a traumatic situation. Medications is usually going to be whenever new medications are started. You're taking medications without doctor's orders, or we've made changes to like a blood pressure medication, or maybe we're drinking while taking medications. So this is why it's important to monitor your blood pressure. Sometimes, like I said, we have to make adjustments. Sometimes we overshoot, or we're trying to hit our target range within that normal blood pressure range. It happens. We practice medicine. Sometimes we go a little too far. We have to back it off a little bit or try something else. So heart problems, that's going to go down into deep hemodynamics. That would require its own set of medications and specialty doctors. I'm not going to cover that too much in this video. It's just one of the things that can cause it. And then you have orthostatic hypotension, which is the one that generally is very short-lived. So what orthostatic hypotension is whenever you go from like a lying position and you go to a standing position in a very fast way. And generally what will happen is your body has trouble trying to regulate that change in position. You're not able to push enough fluids to the heart quick enough. The heart's not able to compensate with its heart rate in time and increase the pressure for that change in position, because there's a lot that goes on whenever you change position. There's a lot of shifts in fluids and directions that they're going, forces that they're having to fight against, and the body sometimes just doesn't respond quick enough. So in order to combat this, all you would have to do is get up at a slower rate. Instead of going straight from lying to a standing, go from a lying and sit up and just sit there. And then go from a sitting to a standing after you've sat there for a little bit. If you got dizzy while going into the sitting position, let the dizziness kind of go away for a little bit before going into that standing. And what orthostatic hypotension will usually do is have a very sharp drop in blood pressure in that change in position, and then it'll gradually climb back up to a normal blood pressure, or what your normal blood pressure would be. But it's just waiting on your body to compensate and make the adjustments it needs to do this. So some of the treatments for hypotension is going to be increasing salt intake. This is something, like I said, that you would have to talk with your primary care provider to see if this is what the issue is. Maybe you are sitting like a normal salt level and you require some more salt. Or maybe you went on some type of diet and you've cut way too much salt out of your diet, and now you're sitting way too low on salt and you need to adjust to where your salt levels are. Compression stockings, this is a very tight sock that sits on the leg, and it helps restrict some of the blood flow. It helps feed blood back into the vessels, adding volume, which increases blood pressure. There's actually also a abdominal binder that can sometimes be used as well to help with this. But it's just more or less, it's pressure added to help increase the volume, help increase resistance, therefore increasing the blood pressure. Medications, adjusting medications. Like I said, sometimes we add a new medication that may not even be for blood pressure and does affect blood pressure and can drop your blood pressure. Sometimes we make changes to blood pressure medication and increase them, or add a second one because your blood pressure was too high, but then we make it too low. We might need to make some adjustments. Sometimes we need to take something off. Sometimes we need to mess with dosages. There's a variety of things. And then also, if you're drinking while taking medications, that can sometimes do it. So the biggest risk with the hypotension or low blood pressure is going to be syncope or passing out, falls, which can sometimes cause trauma, fatigue and weakness. And then also, if you let it ride out long enough, you've been symptomatic, you've ignored the signs, and no interventions or help or treatment was sought after, it can lead to organ damage, whether it be brain, kidney, heart, eyes. It could be just about anything. So that's kind of the big high points that I've wanted to hit with the blood pressures. I will elaborate further into some of the things that I didn't cover very much into this video. Like I said, I want to keep this video as short and sweet and simple as possible, just to hit all the high points. That way you can better understand what some of these things that affect blood pressure is, what blood pressure is, why it's important. And hopefully I did a good job at doing that. So if you like something about this video, let me know what that is so I know what to really keep pushing for. If there's something about this video you didn't like, if I went too slow, if I went too fast, if I covered something too much, or kept repeating something over and over again and it just doesn't sit well, let me know. I want to try to make the adjustments on future videos. That way it can help more people watch, more people understand. That way we can hopefully, as a community, become healthy and more understanding of how medicine and other conditions work. But anyways, thanks y'all for joining. Hope to see y'all again next time, and y'all have a wonderful day or night, depending on where you're watching it in the world. And until next time, I say goodbye.